Hey, you guys, what did the baby corn say to the mama corn?
I don't know.
I don't know.
Where's popcorn?
That's cute.
You caught us again, just a silly dad joke. Hey, welcome again to the Whole You podcast, brought to you from by Nebraska Total Care. I'm Dr. Chris Elliott, Chief Medical Officer for our health plan here in Nebraska. Nebraska Total Care is a local health insurance product, and we are throughout Nebraska delivering health care wherever you are throughout our state. Today, we're talking about maternal care, everything about healthy mothers, healthy babies, and I have with me Nancy Laughlin-Wagner and Erica Anderson. Nancy is our Vice President of Population Health and Chief Nursing Officer, and Erica is our manager of our care management team. So welcome, you guys. Thank you for joining me.
Yeah, thanks for having us.
So Nancy, tell us just a little bit about yourself.
Oh, sure. Yeah, so I'm a registered nurse. I went to school at Creighton University in Omaha, Nebraska, and I've been working in healthcare in various settings for the last 20 years or so. I know I was at a time in my life where I had to decide what I wanted to do for a career, and at that time my grandmother had been experiencing some health issues and in and out of the hospitals, and through that time I really got to witness firsthand the difference I think a nurse can make in the outcomes of a patient and the impact on their experience. And so it was my calling. I knew I could take my care for people and put it in the healthcare industry, and I've held a number of roles in different settings, but I always hold that nursing near and dear to my heart.
That's fantastic. Erica, how about you? Tell us a little bit about your background.
Well, I'm not a nurse. I'm a licensed mental health provider, so my background's in marriage and family therapy, and I'm also the manager of the Smart Start for Your Baby program. And I think that being mental health background has helped me view pregnant members, any members, as a little more holistically than maybe I could be if I was just focused on one area. So I think it's helped, and I have a passion for babies, which who doesn't? I mean, babies are the cutest.
Yeah.
Isn't that the truth? Yeah, at Nebraska Total Care, you know, we try to look at the entire person and treat them as a whole. And so physically, mentally, socially, spiritually, and so we have our staff have various backgrounds, and it really adds to the care that we give to our members. And that's so great. Thank you guys for joining me today.
Yeah, thanks.
So as we get into discussion about prenatal care and mothers and babies and so forth, let's chat a little bit, Nancy, about, you know, before someone might get pregnant. What's important? It's such an important period to kind of get the body healthy, to get ready to have a baby and so forth. Any recommendations that you have for our members?
Yeah, absolutely. It is. Pregnancy is a journey in and of itself on the body, and it's one that you want to optimize your health beforehand and during your pregnancy. So I think the first thing I would really tell anyone listening is, if you want to become pregnant, you think you might be pregnant, or you know you're pregnant, it's really important to get with your doctor. You know, your doctor is going to take a look at you if you have a chronic condition like high blood sugar or high blood pressure. They're going to help to manage and control those things throughout your pregnancy. The doctor is also going to do things like look at what medications you're taking, you know, whether they're prescribed or you buy them at the drugstore over the counter. It's important that if you're pregnant that you know that the medicines you're taking are safe for you and your baby. I would also tell someone that's pregnant to eat well. And by that I don't mean, you know, eat everything you want and use it as a great experience to gain all the weight, because you're going to anyway. But what I mean is to eat a balanced diet, eat nutritious food. It's a time of rapid growth and development for the baby. Baby will have a heartbeat at 6 weeks of conception, and by 8 weeks, all their major organs are fully formed. And so it's really important that you are getting fuel for yourself and your baby throughout that journey. I would also say it's important to stay well hydrated. You know, you need to drink a lot of water, make sure you're getting enough fluids, and get rest. You're going to need it. You know, again, all that change in growth and development, your body needs to rest, and so rest is really important. And the last thing I would say is there are things to avoid when you're pregnant or you want to be pregnant. So you should really avoid alcohol, avoid nicotine, please don't smoke. Drugs, all those things can interfere with the growth of the baby, and so those are things to avoid if you're pregnant or you want to be pregnant.
Yeah, and you mentioned smoking and nicotine and so forth, and even vaping, is not a great idea during pregnancy either, is it?
Right.
Yeah.
Yeah, it can lead to a lot of complications.
Right.
So it's best just to avoid those things altogether.
So kind of like you alluded to, those first few weeks of pregnancy are so important. That baby's rapidly developing. All those major organ systems are developed by 6 to 8 weeks. And a lot of times, the pregnant person doesn't even know that they're pregnant yet. And so how do we actually go about deciding how far along people are in pregnancy, or how do we time the pregnancy?
Yeah, that's a great question. So a normal pregnancy is going to last about 40 weeks. And you do that by knowing the first day of your last menstrual period and planning for the next 40 weeks following that. That's going to tell you where you are. Again, your doctor, getting with your doctor, they're going to help determine about how far along you are in your pregnancy. And it's great. It's great to know that information because you can then follow along and understand how your baby's developing and at what stage that's going and kind of what to expect for your own body as it's going through changes. But, any labor or birth that would happen before 37 weeks of gestation would be considered pre. So a preterm birth or a preterm labor. And we want to avoid that whenever we can. There's complications that come with that. Sometimes they're very minor, and sometimes they're really severe. So making sure that the pregnancy can reach full term is really important.
Yeah, for sure. Thank you for that. Erica, okay, so now we found out we're pregnant. And what next? What if I was a pregnant person, what should I do?
The first thing I think I would do is call the doctor to make an appointment. The provider is going to help you determine the schedule, the cadence of what you have to go in to see them for. It's also there's research that says that going into the doctor early and often is going to prevent low birth weight babies, premature deliveries, help address any of those complications during pregnancy, and it kind of overall supports a healthy pregnancy, healthy baby, healthy parent.
Yeah, and I like that. It's so important to get in as soon as you find out that you're pregnant, so the doctor can see you, evaluate things. If there's something early that needs to be addressed, they can be right on top of it and then follow you throughout your pregnancy. So I appreciate that. And so during pregnancy and so forth, what are strategies and lifestyle choices that a person would make to really help bolster the fact that they stay healthy and their baby stays healthy?
And I already mentioned the first thing, which is going in to see the doctor early. And I hear people say, well, it's my second baby, it's my third baby, it's my 10th baby. For every single pregnancy, they want you to go in early, they want you to go in regularly. The other thing Nancy had already mentioned is alcohol, nicotine, drugs. There's no safe time during the pregnancy to have alcohol, and there's no safe amount during the pregnancy to have alcohol. All those things can have negative long-term effects. So you do want to stop those things. You want to start taking prenatal vitamins because the nutrition that you need and that the baby needs, you may not be able to get out of your diet. So you want to do those things. And then you just kind of want to talk to your family if that's appropriate to get that emotional support that you need.
I know in this day and age there's a lot of people that exercise and so forth as well, and there's a lot of questions about, okay, can I continue to exercise during pregnancy? Should I not exercise? What would you recommend there?
I would recommend them talking to their doctor. I think that lots of times there's so much pregnancy information that comes by. You think, I can't possibly remember all this. Well, what you can mostly focus on is you have the provider in your corner that's able to help you. And if you want addition to that, we have case management services here that can provide that support for all those questions, and I'll probably talk about that a little bit later, but you have plenty of support, arms to wrap around you.
Yeah. Well, thanks. And Nancy, we talk a little bit about why it's so important and things to do to prepare for pregnancy and early pregnancy. When you are going in to see the doctor for those routine visits, what might they be looking for, and why is it so important?
You know, it is really important to get care throughout. So once you get established, your doctor is going to tell you how often you need to come back, and you know what to monitor in between the visits. They're looking to say, is baby growing at the healthy time? Is mom healthy? Or is her blood pressure under control? Can we hear the baby's heartbeat? You know, there's a number of things that a doctor is going to look at just to ensure the overall progress of the pregnancy, and to make sure that it's on course. And it's, for example, blood pressure. Blood pressure is really important. So, and being pregnant can affect your blood pressure, and you're going to want to make sure that it's under control. And the best way you can do that is by regular visits with your doctor. They're going to measure it, they're going to monitor it. If it's not in control, they can treat it. So it's, you know, there's hope for some of these chronic conditions. But high blood pressure, the effect it would have is it's going to reduce the blood flow to the placenta, which is how the baby's getting the oxygen and the nutrients that it needs to grow and develop. And so we don't want to restrict that at all. So blood pressure can lead to complications down the road if it's not well managed. So
Yeah.
it's definitely a time of change, and an important. It's really important to stay connected with your doctor.
Yeah, and you know, some people have high blood pressure even prior to pregnancy. Some people develop high blood pressure during their pregnancy. Another big screening that I know the physicians do is for diabetes. You can develop diabetes during your pregnancy. We call that gestational diabetes. And it's very important to stay on top of that, have that treated, and have that healthy baby. Left untreated, there can be all kinds of different complications related to that as well. And so, Erica, what would you say, there's different routine health maintenance issues that we all have depending on where we are in life and what time of year and so forth. Are there routine health maintenance things that pregnant mothers should keep in mind as well?
Yes, there's some vaccines that are recommended by the CDC. There is the T-TAP that is recommended from, I think it is 27 to 36 weeks of pregnancy. That's the whooping cough vaccine. So that helps people pass along their immunizations to the baby, because babies can be at risk to develop that and they don't have the protection. We have the flu vaccine, which again does the same thing, provides the baby some protection. And we have the RSV vaccine, which is from 32 to 36 weeks, September through January is recommended, and there's a lot of babies that get RSV. It's particularly bad for babies up to a year, especially under 6 months, and this will provide that additional benefit.
That RSV, it stands for respiratory syncytial virus, and it's a serious virus that, you know, for you and I that are healthy, it might just be the common cold. But if you're a baby or a premature baby, or if you're elderly and your immune system is compromised, it can really make you very sick. Hospitalization, some people die from it. So that's just a really great brand new vaccine we have that can protect those premature and very young babies. And it transfers from the placenta, and that's why they give it from 32 to 36 weeks during that time period where RSV is around our communities, correct? Right. Now, you mentioned that the CDC recommends vaccinations. What is the CDC?
Center for Disease Control.
Yeah, so it's a national governing body that recommends different, they go through all the studies and so forth, coagulate those, and make sure that they're recommending things that are useful to us and are not harmful. Erica, what other resources do we have that the care management team can help to support pregnant people?
So our case management team has several OB nurses. We have a mental health therapist. We have a social worker that work with our pregnant members to provide education, resources, to talk to their providers, to kind of assist with their treatment planning. We do baby resources, of course. I mean, obviously people need those, but we're also talking about housing resources, utility resources, or maybe food. We're trying to really help wrap our hands around the whole member. We do telephonic, we do a perinatal coaching program, which could potentially go out into the community and meet with members. We do a lot of things to kind of support our members throughout the pregnancy.
Yeah. And at Nebraska Total Care, we have several products. We have Medicare, which takes care of the elderly and disabled, right? That wouldn't really pertain to pregnancy. But we have Marketplace and we have Medicaid. And especially with our Medicaid products, we have some value adds that we offer. Can you review that for us a little bit?
Sure. And this, thanks for asking this question, because I think people think or feel that the Nebraska Total Care will automatically know if they're pregnant based on claims. And the surprise people have is that Nebraska Total Care, Nebraska itself is a bundle billing state. So it's very possible we might not know a person was pregnant until after they deliver. So we've worked to incentivize a notice of pregnancy so that members can submit this to us through the portal, through calling us, their doctor's office could submit for them, so that we know that they're pregnant. And to incentivize this, we offer a stroller, a pack and play, car seat, or 10 frozen meals if you do a notice of pregnancy within 60 days before your due date. And that's for the Medicare population.
For the Medicaid?
Medicaid.
Right.
And the reason we do that is we know that the earlier that we can help get connected with the member and engage with them, the better their outcomes can be. Some of the other services, especially with our Medicaid population, we can offer group prenatal classes, doula services, lactation consultation. There's just there's so many supports that we can offer and give, and so the earlier we know, the better.
Yeah, that's so true. The studies have shown that that routine prenatal care, catching any illness or disease process early and have that treated, it really decreases the chance that you'll have a premature baby and have many problems and increases the chance of a healthy baby. So that's very good. Yeah, I appreciate that. So Nancy, we've talked a little bit about how do you prepare yourself for pregnancy, all the things that we look for during pregnancy and so forth. Is it important also after you've delivered, say you have a normal delivery or a C-section, to follow up with your doctor and your baby's doctor after delivery? And how should we go about that?
That's a great question, and I think sometimes people are very busy with newborn at home, and seeing the doctor maybe falls down the priority list. But I want the listeners to know that really, after the baby is born, they're now entering what's considered the 4th trimester of pregnancy. It's that 12 weeks following, it's a period of rest and recovery for your body to return back to its pre-pregnancy condition. And it is really important to get in. Like to get people in within 3 weeks. You may have a condition like if you had high blood pressure during your pregnancy or diabetes, your doctor may want to see you sooner to keep an eye on that. They're going to look to make sure that your body is healing and recovering as expected, and look for anything that may be a sign of more serious complications, because they can happen. We can see people have trouble with being able to go to the bathroom. We can see people retaining fluids, developing blood clots. There's a number of things that can happen from a physical standpoint. There's also things that happen with our mental health after we've delivered a baby. It can happen. People can feel anxious. They can feel depressed, lonely, tired. All of those things can happen. And so again, it's another reason to get in with your doctor, share any symptoms you're experiencing, whether they're your mental health or your physical health. Make sure and share those things with your doctor so that you can get the help that you need, because we don't want people to suffer, and it's very important. So again, just after baby's born, now you're in your 4th trimester. It's important to stay connected throughout that time.
Yeah, and we don't want to scare people. There's a few things that can go wrong during pregnancy, but it's just so advantageous to get in and be followed closely throughout the pregnancy. Such an exciting time and expectant time to have that new baby. There's some things that don't show up right away in the babies too, right at the first day or two of life. And so it's important to get in and see a pediatrician, that first week or two after delivery. They can have some heart problems or other congenital abnormalities that don't show up right away. And then also, we've heard about preeclampsia or pregnancy-induced hypertension and so forth, and that's a condition that sometimes doesn't develop through pregnancy, but it does within 2 to 3 weeks after delivery. And so very important to have your blood pressure checked and make sure you don't go on and have serious complications from that as well, isn't it?
You know, and the other thing, postpartum or after the baby is born, just like in the pregnancy, how the baby grows and changes and develops rapidly, they're going to do that after they're born, you know. So it's the kind of the course of progression. There's some milestones that your doctor's going to look to say, is the baby meeting the milestone? Are they at the right you know, height and weight? Are they, you know, developmentally meeting some things? And they have expert eyes that can look at those things and really know if there's an issue there to be addressed. And so it's really important, yes, for your own care to get in for those postpartum visits, but also for your baby's care. You're going to want to establish routine appointments with your baby's doctor. They're also going to talk about vaccines. We talked about those earlier. Babies now going to need their own vaccines to kind of go through to help protect against illness. They're tiny and small, and they need that additional protection.
That's right. Very good.
I'd like to add that if there's any barriers to getting to those appointments, to please contact Nebraska Total Care, because we do have some resources that could assist with that. We don't want to have transportation or other things be the barriers, and we want to help people get to those appointments.
Yeah, that's what our team's here for, is to be that conduit or that go-between, help, you know, foster those relationships with doctors, help schedule those appointments, help get people to the appointments and so forth. It's just amazing the resources that we have to offer our members, and we ask them to use us, right? And not near as many as we would hope to, but we're hoping more and more. Yeah. Anything else you guys want to add?
I don't think so.
I think we covered a lot today, and gives our members and our audience a lot to think about. Thank you so much for joining us in this maternal care episode of the Whole You podcast, brought to you by Nebraska Total Care. Until next time, we appreciate you. We're wishing you excellent health. And remember, when you feel well, we feel well.